Hello, my friends. This is a new case of our playing list related to the frame of MRCS examinations to get more marks in the field of examinations in MRCS Part B. I'm a Dr. Hamza Lashwa and welcome everyone. We have to start our case today with knee examinations, which is an important case, which is an important case in the examinations. Okay, we have our frame as we see before. You have to go by this way. After introducing the room, wash your hands and introduce yourself and confirm the patient details, explain the examinations and gain the consent, and also ask the exposures and offers the chaperone, and don't forget to ask about the patients and go for the main scope of the case. We have to look and feel and move. This is the three secret of orthopedic cases, and we have to done some special tests. And don't forget to, after end of this, thank the patients and wash your hands and go for your examiner to present the case and small discussion about what you find in your case. We have to go by details, more details. Firstly, after introduce, wash your hands and introduce yourself. Hello, my name is Dr. Hamza. I'm one of the surgical doctors. Could you please confirm your name and age? Please, okay. And today I have been asked to examine your knee, which including look and feel and move and doing some special tests. Okay, was that okay with you? Okay, and the examination including exposure of your both knees from the hip joints and lie down. Okay, and the examiner with you as a chaperone. Okay, and go to ask about, don't forget to ask about the pain before you start. Do you have any pain at the moments? Okay, and go on. We have to start from standing position of the patient. Could you please stand up for me and go for assess the patient gait? Could you please take a few steps for me? I have to change the color. I'm sorry. I have to change the color to be clear with you. Okay. Firstly, in the looking, could you please stand up for me? Okay, and could you please take a few steps for me to assess the gate? Okay, observe the gate cycles and inspect from front. After the gate, the patient standing position, and you have to look from the front for quadriceps bulk, for the knee swelling or deformity, for the foot deformity. Okay, and you have to look from the side for the knee flexions, the foot arches, the toe deformity. And we have also to look from behind for what? For iliac crest alignment, for gluteal muscle bulk, for popliteal swelling, for hind foot abnormality. After this, you trans to feeling the knee in supine positions. Could you please lie down on the examination couch? Okay, and start firstly by temperature. If it's increasing, it's indicated for inflammations, and also palpate the knee with the leg straight for quadriceps tendon, for patella tendon, for patella medial and lateral borders, and also palpate patella tap. Doing the patella tap allow detection of large joint effusions, and doing the sweep test. The sweep test by allow detections of small joint effusions. For large joint effusions, it's a Batalla tap. For a small one, it's a sweep test. Empty the fluids from middle aspect of the knee into suprapatellar pouch and hold the fluid in suprapatellar pouch with one hand on the medial side. Sweep down from suprapatellar pouch on the lateral side. The appearance of bulge or ripple on the medial side of the joint suggests the presence of effusion. Okay, and also palpate the knee whilst flexed at 90 degree. Palpate the patella tendon again and the tibial tuberosity and the medial joint lines and the lateral joint lines and the head of the fibula and the collateral ligaments, and don't forget in these positions to palpate subpopliteal fossa. Okay, and also don't forget to measure and compare the quadriceps circumference. After that, we have to go for the moving active one and passive one. Active by knee flexion and extension. Okay, and the passive by knee flexion and extension, and the passive knee hyper extension, which is important. Okay, and after this we have to go for the special tests: posterior sag sign, anterior and posterior drawer tests, Lachman test, valgus and varus stress test, and McMurray medial for medial and lateral menisci. And this is how to do by Arabic language. Okay, and finally you have to thank the patient for let me examine you. Do you need any help? And wash your hands and go for your examiner. Thanks for your listening. You will get more marks by this frame. I promise you.